Thanks for joining us today. A warm hello from San Francisco, where I've been sheltering in place for nearly 4 months now. And the next session is on voice and the pandemic. It's a timely and relevant topic given the current events of this year and what's happening around the globe. So for today, we will be exploring the use of voice, chat, and conversational applications for COVID-19 frontline response. I will specifically be speaking about voice response, but also some elements of conversational AI generally woven throughout. So without further ado, I'd like to jump in. It's great to meet you all. My name is Kristi Ebong. I lead strategy at Orbita. Orbita is the leading conversational AI platform for healthcare and life science organizations. The company is about 5 years old, and we provide voice bot and chatbot applications to organizations across the pharmaceutical world, the payer world, and also within the provider community, as well as to many large technology companies and med tech and medical device companies. My whole career has been in health and tech. I actually started out at a little company called Epic Systems many moons ago, and have a healthy appreciation for the existing infrastructure in the industry from a technology perspective. And then most recently, I led emerging technology at Cedars-Sinai, where we launched the Healthcare Accelerator program there and evaluated over 3,000 early stage companies over the last 3 years. Looking forward to sharing my thoughts with you today. I am a public health person by background. I did my master's in public health and my MBA at Johns Hopkins, and also have a little bit of background in global security and political science from my undergraduate degrees. So looking forward to sharing what we've been up to in these interesting times and the intersection of voice with healthcare, global security, and public health. So things that are relevant to all of us currently. It is no joke. As you can see here, this was effective from last week, the second week of June. There are about 8 million confirmed cases globally. We know that the actual case count is much higher than this. Global deaths that are confirmed are around 500,000. Again, we think these numbers are much higher. And this is just about 4 or 5 months deep. And so these numbers are continuing to climb. What's most interesting, I think, is just that the US really has our own market share in terms of confirmed COVID cases. And so we are seeing a mixed hybridized response to the pandemic. What was originally outbreaks concentrated in urban areas has now spread and is escalating. The highest infection rates are happening in rural counties. And so it's going to continue to be an interesting summer as we progress here. And then also, this is another view from the Johns Hopkins dashboard that many of you are familiar with, just showing a heat map of confirmed cases by county here in the United States. And I think what's so interesting about this is that we're really looking at a pandemic that started out, as I mentioned, in urban areas, but has been quickly spreading throughout many parts of the country, and particularly some areas that struggle the most with resources and access to healthcare, as well as have some of the highest existing disease burden with chronic diseases. We do know that the novel coronavirus, or what was called COVID-19, is a vascular disease. And so we're looking at vascular origins and vascular inflammation within the blood vessels and the arteries throughout the body. And so it makes sense that many patients with existing heart disease or other diseases of vascular origin are compromised as well. When we think about this and what does all of this mean and how do we use technology for this response, it begs some interesting questions. It begs a question about how long is this going to last? Many experts are saying now there may be an annual COVID-19 season, that this may be here to stay. And so when we start thinking about, even after a vaccine, what does the new normal really look like for healthcare specifically? It's interesting to think about how the industry and the delivery of healthcare has shifted so phenomenally in the last few months. We've really, in some ways, jumped ahead about 10 years in terms of adoption of digital technologies as a way to scale our response to the pandemic and to the virus, and as a way to keep people safe. And so as we think about what does the new normal look like, it's also important to understand that the new normal is not going to look like the old normal, and that we will continue to have to navigate some of these dynamics. And so with that, I wanted to start with taking a look at how COVID-19 has fundamentally changed the healthcare delivery ecosystem. We are talking about virtual care visits, and these statistics come from our friends at Forrester, specifically my friend Ariel over there. She mentioned recently that the virtual visit adoption just in the last 2 quarters alone has now soared to over 900 million COVID-19 related video visits or virtual visits. We're still looking at 200 million of those general care visits be done via video. And what's really remarkable is looking at the mental health toll of all of this, the 80 million mental health visits that have been taking place due to the enormous strain on everyone's mental health in the country. But this is really important for us to note, because this is so different than how healthcare was traditionally delivered in the past, where you would show up to what we call a brick and mortar institution, an actual physical building, a clinic or a hospital or an urgent care or an emergency department for care. And now the front lines of healthcare delivery are really done virtually. And that is what we're seeing regardless of digital literacy, and also in some cases, regardless of what we used to think of as the boundaries of access. And so taking a look at what access looks like is also important. And I'll jump to that in just a moment. We're also seeing a little bit of the deterioration of the doctor-patient relationship. And so this is not new. This is something that was happening before, but healthcare leaders have a big conundrum on their hands. And so as the organizations are losing patients at higher rates than they're acquiring them, in part because, and more than ever, a lot of the services are shut down to keep patients safe and to keep patients at home. It's an unsustainable trajectory from a business perspective for many healthcare enterprises. And so we have gotten a few different market dynamics that are exacerbating that in the face of the pandemic. One is growing competition from customers experience-centric companies. And so what we're seeing here is that companies that can meet you where you are in the safety of your home through a device that you already have, whether that be an analog phone or landline, or a smart speaker like an Alexa, Amazon Alexa Echo device, or a Google Assistant device, or even through your smartphone, through voice or text chat on your smartphone. And so companies that are able to meet patients where they are increasingly threatening to many of these patients. We also are seeing increasingly fatigued workforces, so clinician burnout. Physicians and nurses are exhausted. A lot of us have seen the mainstream headlines, especially since the pandemic hit, with the affect on a lot of our clinicians who are really working long hours and in exhausting environments. And then last but not least, the shifting healthcare delivery models. And these are 3 macroeconomic trends that, according to Forrester, who really have their ear to the ground, are affecting how patients everywhere are receiving care. And so it's interesting to pay attention to these trends as things move forward. Healthcare access is a really interesting issue in this COVID and post-COVID world. And so what we're seeing is that today's consumers really face significant challenges in how they ultimately navigate to and receive care. And so what does that actually mean, or what does that look like? Patients are having issues around accessing care and just searching care. And so if you think about it, when coronavirus hit, and even before COVID hit, 89% of consumers, when they need healthcare, turn to Google search and they ask questions like, how do I know if I have coronavirus? Or where should I have my colonoscopy? Or can urgent care do x-rays? And unlike decades ago, when most consumers had a primary care physician or family physician that would oftentimes stick with you throughout the majority of your life, now less than half of consumers use a primary care provider as a first step in finding care. And 45% of Gen Zers don't even have a PCP. So this is quite interesting when you think about the digital use of technology, and specifically the impact of voice. And so whereas we started out with search in 20 years ago with using keywords, Now, and you can play around with this on your own as well, if you type into your Google search browser or your Chrome browser in a Google search, for example, you say things like, how do I know if I, and it will show autocomplete opportunities for coronavirus, if I have COVID. And so the way that we search in a natural language query with our voice, regardless of the actual search experience or search process, the way that those results are coming through is fundamentally changed. And so even if I do a keyword search, the natural language query process has changed the information that displays to me and how it displays to me. And so addressing and getting in front of how we meet patients and consumers where they are with voice SEO, with voice search is really, really critical. And I think it's completely changing the access line within healthcare delivery. We're also seeing access challenges in actually navigating the care. So once you've identified an organization or a service or a product, there's a lot of lack of directional guidance. And we've seen this at unprecedented scale with the COVID-19 crisis. We've seen this previously with things like if you asked, who does cataract surgery that accepts Cigna for insurance? Can urgent care do x-rays? And what are the results that you get? And how do you navigate to the right entity that does that, that's covered by your insurance provider? We're now seeing this with, for example, where can I get tested for coronavirus? Patients are asking questions like, where do I get a PCR test that tells me if I currently have the infection versus an antibody test that tells me if I've ever had it? And so the digital front door for accessing and understanding care, not just as an afterthought, but as even a fundamental to things like how we all return to work. How do we go back to the workplace? And finding the tests that we may need or the information that we may need to return to work in a safe environment with our colleagues, or to school, for example, is really important. And so I think what we're seeing is the advent of voice, both in search and SEO, is also impacting how we are all navigating the pandemic in this crisis. And so it's going to be an interesting road, to say the least, for how organizations start to optimize for and solve for some of these issues so that consumers can get to the right place. And especially this, what we call incoming tsunami of patients that haven't been receiving care the last few months due to the COVID pandemic, desperately need it, and are a massive wave that is about to hit our delivery systems. As we've seen consumers struggle with navigating the healthcare system, so 1 in 5, this is 20% of US consumers, expect that the pandemic is going to strain their access to healthcare. A lot of us, now that we're almost a half a year deep, have already experienced this personally. These stats come from, again, our friends at Forrester, who've been really leading the charge on helping us better understand the consumer environment around access to care, and the digital access points through the healthcare system. We also have 1/4 of US consumers that are expecting that COVID-19 is going to weigh on their mental health. I would not be surprised if this number continues to climb dramatically, as it's been a massive once-in-a-lifetime adjustment for, I think, all of us. And then half of US consumers just don't feel confident that they can access virtual care if they have to. And so as we continue to look at not just how do we address COVID symptoms and the actual infectious disease burden of this pandemic, but also how do we continue to navigate our well care, our preventive care, and really our sick care for a lot of patients that continue to need surgeries and procedures that may have been postponed or canceled, and that burden is just sitting there waiting. And so I think these things are all issues that we're looking at. What's interesting, if you think about the intersection of voice with the pandemic, what we're seeing is opportunities for voice to solve some of these problems are coming up everywhere. And so what's really cool to me and really exciting to me is to see the innovation, just the sheer grit and human power behind using voice to solve some of these hard problems. And so what we saw here, the headline you're looking at from ABC News, was that ICU nurses using baby monitors. And they're using baby monitors to communicate with patients in their room. It's preventing them from having to unnecessarily go in and out of the room, and so therefore saving on protective equipment, or what we call PPE. And it's also continuing to keep those patients connected and engaged when we're trying to minimize exposures to keep our workforce healthy, and also to prevent some of that loneliness and isolation during some of the scariest times of their lives. And so just a baby monitor, one of the, old audio voice and now augmented with video screens monitors is being used for frontline care, which I think is just extraordinary. And also a reminder that voice is transcendent above the latest smart speakers, and we access information via voice across all kinds of channels all the times, and apparently baby monitors are also one of them we should keep in mind. We're also looking at this challenge around adoption has happened, but the business world hasn't caught up. And so the healthcare or life science organizations are still catching up. Many of you heard the horrible story, it was well documented in the media in the New York Times, specifically a dying coronavirus patient was asking their Amazon Alexa Echo device, how do I get help? And unfortunately, she passed away. Her name was Luann Dagan, and she was talking to her Alexa voice in her final moments, trying to figure out how to get help, how to get treatment. And so what we're seeing here is this extraordinary and humbling moment where consumers and patients, and even some of the most unlikely of patients to adopt digital technologies, so especially the ones most affected by COVID, the older patients, and those who may not have adopted any other tech since maybe their phone or their analog, or their landline. And so the imperative of organizations to get on board with providing this information and this connection to patients is so critical. We're seeing a lot of challenges remain for enterprise adoption when it comes to HIPAA, privacy and security. Some of those restrictions have been suspended momentarily during the pandemic, much to some anxiety of a lot of chief information and chief security information officers, or information security officers, around what does that look like long-term and how do we really get in front of it. And so we're seeing markets surging ahead with the adoption of this, and the question remains, how do we continue to get in front of it at a global level? We also saw a new threshold where organizations like for Google Assistant and Amazon Alexa specifically seeking to control for misinformation that was out there. And so there were some headlines around Amazon Alexa pulling coronavirus skills from the skill that were available, and also the Google Assistant actions to make sure that people and consumers were not getting false information, were not getting information that could be potentially harmful or outdated in an environment where the disease burden has been shifting and our understanding has been evolving so rapidly. And so this is really interesting where we're looking at an environment where, for example, Amazon pulled all COVID-19 skills in the early days of the pandemic, and now are gating those pandemic-related skills in the interest of public health and public safety. The good news is that they are working closely with some of the thought leaders in the space to make sure that information gets to patients and consumers that's appropriate, that's clinical grade, and that's updated. An example here that we actually worked with at Orbita closely is with Mayo Clinic. And so Mayo Clinic worked closely with the Amazon Alexa Health and Wellness team to launch their COVID-19 skill, which is clinically vetted, it's been gated, and it provides information that users can trust, which, as we all know, is so critical in the voice and healthcare world. When we take a step back and think about where we are within the pandemic globally, we really look at this, there's a crisis management map here from the Harvard Kennedy School that shows 5 stages of crisis management. And so if you look at where we started around looking at protection starting before December of 2019, we then were shifting into how do we prevent from the US perspective, how do we prevent and contain before it hits our shores. We had the boom moment, and then now we're in the response. And so when you're in the response phase, we're looking at how do we look ahead to recovery and how do we start planning for that recovery. And that recovery is incremental, it is iterative, And so we want to what we call get ahead of the curve. And so how do we use voice and other technologies to get there, as the new normal is likely to make this an ongoing dynamic to navigate? As we talk about this recovery phase, we start thinking about returning to work. What does this look like? There was one headline that said, return to work during the coronavirus pandemic is like navigating through an employment law minefield. And so when we think about using voice to navigate all of this, we go back to the opportunities for voice search and voice SEO. How do you optimize for that? How do you dynamically update and change the information that's being provided? And how do you continue to stay connected for folks that are maybe more isolated, especially for those that are, in an infectious state, and have to rely on technology for staying connected? I thought this was a really interesting quote. I wanted to share it with all of you. It talks about how the challenge of the new normal is unprecedented, restoring the economy and livelihoods while managing a very real risk to human life. It talks about going back to work will involve countless unknowns, but the leading companies will need to advance where they can, retreat as soon as they must, and adapt as needed. And so when we think about this and we think about the intersection of voice technology and all the ways that it's being used to respond to the COVID and post-COVID world, it's really important to understand that this is going to be an ongoing dynamic to navigate. And so what are some of the priorities that we want to look at from the healthcare industry perspective? The first of these is really improving access to care. So as health systems come back online, as we start to backfill and reschedule surgeries and get patients in to be seen, we really need to look at how do we assess and check for symptoms? How do we measure risk? What can we handle in the safety of one's home? Whether they're in a senior living environment, whether they're in quarantine, whether they're a healthy child that just needs to be brought in for a well child check. And so using voice to improve access to care is going to continue to be a top priority throughout this post-COVID new normal. Additionally, streamlining communication. So if anybody has not had challenges with communication in an environment where the information itself is rapidly evolving and changing, we've all experienced that firsthand. And so thinking about the virtual agent use of voice, whether that's delivered via a smart speaker or even over the phone through a voice bot, virtual agents are much cheaper than a live contact center agent. They're able to provide triage to diverse and broad patient populations, especially if provided through the channel that's native to the populations you're working with. And then also escalating patients who need the most help to live agents and to live caregivers and care team members that can help them with specifics to them. And then last but not least here, the priority we need to keep in mind is how do we continue to protect and support workers? So we've seen a fundamental shift, and healthcare in the employment arena is nothing new. This country has a long legacy, right, of employer-sponsored healthcare due to policy and legislation from decades ago. But the imperative for employers to keep their employees healthy for the sake of not just the employees, but also business survivorship is going to continue to be important in a dynamic. So using voice to empower employees and empower their safety as we go. As I said, we're not going back to normal, and this is going to be a new normal. And so the question that I love to ask ourselves is, how do we rise to the moment? If this is anything, it's an opportunity and it's a calling for our generation to say, this is what I did in the face of adversity. And when things got really crazy and really rough, this is what I did in my personal life, and this is what I did in my professional life. And so my call to action for all of you is, how will you rise to the occasion? How will you use your corner of the world, your technology, your voice innovations to help support people through some of our most vulnerable moments as a society, as individuals, as workers, as human beings? And so without further ado, I just wanted to wrap by expressing a deep and sincere thank you to our heroes on the front lines. and those that are leading them, both the essential healthcare workers, but also all the other essential workers, the delivery drivers, the folks working through the night to solve hard business problems, the folks working in government and policy to keep us all safe. So with the deepest gratitude, and thank you all so much for your time. My name is Kristi Ebong. I'm with Orbita. Check us out at orbita.ai and let us know how we can help. Thank you so very much.